Excellent, excellent. We're going to keep the train rolling, and just following up that, we have a panel coming up, and the title of this panel is Pathways to Wellness. Again, building on philosophical aspects of cultural differences that Dr. Nichols just talked about, and some practical applications that Dr. Joy mentioned. This panel coming up will be moderated by Herb Alexander. Herb serves as the inaugural Chief Diversity and Learning Officer for Cayuga Health Systems, where he leads health and organizational equity across the system and also oversees learning and organizational development. Herb also serves as Chief Health Equity Officer for Cayuga's health clinically integrated work. Like her and all of our other panelists, their bios, you can see them at www.abcinfo.org. Good morning, Herb, and welcome to Beyond Trauma, a journey to wellness. Welcome, and I will give it to you, sir, and you can take it from here and introduce your panelists, and it's your ball game now. Thank you.
Thank you. I appreciate that. I appreciate the, I would say, amazing conversation that we had today. Really appreciate that work. And I'll invite all of the panelists today to come on video if you can. Great. Thank you. Okay, so I think for time's sake and to make sure that we can make the most out of it, I'll just go right through. And what we'll do, instead of having everyone go through and do the introductions, we'll introduce them as a part of the question. And then folks want to add to that introduction, they surely can. And just one quick thing so that we can kind of get it out the way now. We have limited time. So when we come up to about 30 seconds left in about the 4-minute time frame that we have for folks to respond to questions, I'll just put a 3 up. So that way we all know you got about 30 seconds. And hopefully that's enough time for folks to kind of like summarize their thoughts and what they're saying. I will be able to, or look to ask like follow-on questions if you say something that might have sparked interest for myself or other panelists or the audience. And I think that'll be all that we need right now to set the stage. And so I think we'll start with Jasmine. So Jasmine Brewer is currently the doula program manager at Healthy Baby Network. And so I guess my first question for Jasmine is, your executive director, Shalita Bullock's email salutation includes the slogan, "For babies, their parents, and our community," right? And so I guess what are some of the factors that the Healthy Baby Network thinks that we must do in order to do 2 things? First, reduce infant mortality, which is, I think, a very prominent topic right now, and then also address adult morbidity, right? Another way to say that is, how can we ensure that babies and their parents are well? And so I'll pass it to you to respond to that.
Yeah, so hello everyone. I mean, here at Healthy Baby Network, we like to follow the community-based models. The community-based models, we've seen that it provides comprehensive care, and it addresses a lot of the disadvantages and disparities across the aspect of, like, let's say, our expectant moms, right? When we think about community-based models, we think about having better access to healthcare in our communities, and that improves the quality of care that the people from that community are receiving. And like the program that I manage, a doula program, we have seen a decrease with the number of preterm births. We've seen mothers breastfeed, more mothers breastfeeding, and at a longer duration of times. So yes, that community, going back to that community-based model, it just fosters a better relationship in the healthcare system and quality of care for our clients and community.
Thank you. And you mentioned access too. Are there some key things that folks be thinking about when they're trying to increase access?
Mm-hmm.
Or what key things would you point to as key drivers when it comes to access that folks should be thinking about?
Access, better access in the community, community members knowing where that is and how to be referred or connect in that community, where to go. You know, sometimes it's a lack of not knowing, right? And when I think of access, who do you have access to? Who are the providers in that space? And I don't want to overstep my question, but when I think of that, I'm thinking of, birthing centers and spaces where people go and they feel connected automatically because who they have access to and who is there. That definitely has a big effect on the level of trust that community members feel with their providers and the services that they're receiving.
Mhm. Thank you for that. I appreciate that. So definitely access, facilitating to the idea of knowledge, right? People having knowledge of the services and where to go. And then when folks get there, I think I'm coming from what you're saying is representation, right? Or there will be folks who, going back to what we just heard, who I can connect to, I can build a relationship with, who look like me that I can trust when I'm there. So really appreciate that answer. Thank you.
Yes.
So taking it from there, I want to shift over to Wade Norwood. So Wade has held leadership positions in the community for more than 3 decades, including public service, education, and healthcare roles. And so my time here in Rochester, Wade, you're like a household name, so we appreciate the work you do. And so in management at the Common Ground Health in 2006, Wade has been central to the nonprofit strategic planning process, pushing the organization to become a more effective change agent for all Finger Lakes region residents, especially those most at risk. And so I guess my first question to you is in 2023, Common Ground Health released a report on aging. And so can you share with us what we should know and do in order for our aging population to achieve better health wherever they live?
Absolutely will, Herb. But before I do, let me first of all say how great it is to see you and appreciate all the building you doing down south of us, brah, and appreciate how you bring in Ithaca and Cayuga closer into us up here. Hello to my sisters on the panel. I would open by just noting the fact that I am turning 60 this year. And so when we have conversations about older adults, I want y'all to know we're not talking just about my mama, we're also talking about me. And what I am really proud of this report doing is really centering how it is that we as a society have allowed our system of supports for older adults to really become outdated. And right now, we have the reality of too many folks who are aging who are not wealthy enough to cover the costs associated with aging in place, but who are not eligible for supports because of income. And I am hopeful that this report, while the state is creating its aging master plan, I hope the data that we put on the table calls for a heightened consciousness among marginalized communities, particularly African American communities, that we are experiencing the first generation of older adults with wealth. Why would we consign them to age having to spend out all of that wealth, create no intergenerational wealth transfer simply because of the fact that we have not determined to care enough and to ensure that our health and social support system treats every older adult well? I think it's simple. It's time for us to do our job, and that's to make sure that we are caring for each other.
Wade, thank you for that. And happy 60th year around the sun. Nobody would have guessed it because, black don't crack. But we appreciate you sharing that with us. One of the questions that I have for you, so you mentioned finances, and we know income is one of the social drivers of health. So just to kind of like build on what you were saying, um, thinking about that as it relates to aging, what do you see as the relationship between income, finances, and what we see as far as the disparities between how folks can take care of themselves when it comes to aging here in America?
Absolutely no question. And I would certainly defer over to Jasmine because the Healthy Baby Network are really the folk who really taught me 15, 20 years ago about life course trajectory. And the idea being that how we experience life early has a great deal to do with the pathway that we travel across our lifetime. And a healthy older adult period has everything to do with sound financial planning, has everything to do with economic opportunity. And part of what we see in terms of inequity among older adults is really the legacy of the inequity that we allow to exist for working adults and the inequities that we allow to exist for young people. So it is truly time for us to care for the entire village instead of splitting up the family and having approaches for each age group or each demographic. We really need to think about the community as a whole. And that to me was the uplift from Dr. Nichols and Dr. Joy, really understanding the power of relationships. And in healthcare, because of that word care, in healthcare, you cannot move forward without having a relationship approach between the provider team, the patient, and the patient's family support.
Thank you for that. That's great. Really appreciate it. And Devin, did you want to add anything to that? Past, of course, I know Wade brought you up to some of the things that he's learned. So anything you add to that answer?
It just makes me really think of intergenerational trauma. When moms are pregnant, babies feel that. So one thing that we focus on really during mom's pregnancy is trying to not let her relieve her of some of those stress factors, right? That she feels maybe because of her social economic status, or just care at the provider's office, right? There are just multiple things that's passed down before babies even get here and that they feel. And it just makes me, think of the intergenerational trauma. It's true, it's real. We have all experienced it, whether we know it or not. But it's a real thing, and it's time to do something different about that. And I just want to say, here at Healthy Baby Network, we come here and we pledge every day to dismantle a lot of that, break that up.
Yeah, thank you. Wade, thank you, Devin. Thank you. And so we'll take that and I want to shift over to Lucia Calendris. And so Lucia is currently the Chief Program Officer at Ibero-American Action League Incorporated, and has faithfully served on the Latino Health Coalition for quite some time now. So Lucia, Ibero is an important organization in this town, it's been in Rochester and the greater area. A healthier Latino or Latinx community is a healthier, greater Rochester community. What are some necessary factors, must-dos to enable and support our Latino brothers and sisters on their path to wellness?
Thank you for having me here. Nice to meet you. And buenos días a todos. Good morning to everyone. Good to see you, Wade. We often talk about cultural and linguistic needs. But we must be intentional about those things, right? Like we've been talking about this for the past 25 years since I started my career. I think there's more intention now to make sure that this is happening. But the cultural and linguistics are real barriers for our individuals. And for example, if our local organizations are seeing many Latinos, for example, Latinx members that are utilizing their services, then the staff must also match or mirror that population, right? It's beyond the front desk staff who's bilingual. It's being intentional about who's serving our individuals. And we talk a lot about language access because that's when we see people get lost in translation. So that's only one component, right? Because not all Latinos are Spanish speaking only, but that is a huge gap for us when it comes to access. And interpreting services are a tool, right? Like we utilize it in case we have lack of resources, but we've seen lack of resources for a while. And now it's time to be more intentional about who we're hiring to serve those communities that we're serving. There are specific areas in which we are lacking more than in others. For example, mental health, behavioral health, emotional wellness, or whatever title we want to use, is still an area where we continue to have gaps. And we know that with certain groups like Latinos, behavioral health or wellness services are not necessarily utilized because of those language or cultural barriers. The previous session that we had was amazing. I learned so much because that was right on point, right? Like we're so diverse. And with Latinos, Latinx, we're diverse within our diverse groups, right? Like, so there's complexities within that. So we're not just one, we're like many. I'm from El Salvador, and grew up in a primarily Puerto Rican Latino community. So, it comes with all those components. And we definitely want to make sure that if we're seeing those needs, that we're addressing those needs. The number one barrier still continue to be for many, not for all, getting lost in translation. And also that the advocacy component and partnership. We have partnerships, but when it comes to like creating these programs, we have to see that we're really moving the needle. And I do believe that in healthcare, because I have worked in healthcare systems, there's still some work to be done that is going to require some support or financial support so that we can get to where we need to be.
Yeah, really, first, thank you for sharing that. And I think that's right on point. I know that one of the things that we see is that 1/3 of US adults have trouble reading and applying and understanding healthcare information. So if you imagine that on top of English,
Yeah.
maybe not being your primary or preferred language, and how that might be to navigate, yeah, definitely some work to do for sure. So I appreciate you calling that out. That makes me think about how important it is to collect accurate demographic data, right? So we can anticipate the needs that folks might have, including like the language someone speaks most of the time. So thank you so much for that.
Mhm.
Yes. Okay, so I'm gonna take that and shift over to Dr. Simone Edwards. So first, we appreciate and are happy to have you here. Thank you, Excellus, in the region and in the area. And so she's a devout healthcare leader, health equity champion, strategist, professor, mentor, advocate, you name it, and is currently the vice president of health equity and community investments at Excellus Blue Cross Blue Shield. And so first, congratulations on the new role. And again, glad to have you here.
Thank you. Happy to be here.
Yeah, and so one of the things we wanted to ask or start off with is your reporter is saying that health equity means everyone has a fair chance at living their healthiest life possible, right? And that's also key to building a vital and thriving society in general. So could you elaborate on that statement and what drives you in that type of work?
Absolutely. And again, happy to be here. Happy to have that you invited me here. So the drive to do this work in health equity for me is rooted in a combination of personal values, my experiences. I'm an immigrant. I came here to this country when I was so young, and I was faced with navigating the academic system, trying to figure out colleges and all of that, and faced some tremendous barriers there. And also a deep commitment to creating a more equitable and just society. Many people face barriers. I talked about my barriers, and I had plenty more of those. But many people face barriers due to their race, their ethnicity, or social determinants of health. And these barriers keep some people from leading their best lives. For me, by promoting health equity, my aim is to work to eliminate these disparities and improve overall population health. That means addressing the root causes of health inequities, such as poverty, such as discrimination, and the limited access to education, employment, healthcare, access to healthcare resources, etc. Building a fair and just society where everyone has a chance to live their best health is, and I'm going to say it again, very vital to the work that I'm doing. So I'm happy that I was planted here at Excellus to be able to do this work. And the way I'm addressing this initially is through a community-based approach. through our community partners around us. And also leveraging the resources that we have. We have our Health Equity Innovation Award funding to support different initiatives directly targeted to health disparities, promote access to care, address the underlying social determinants of health that I talked about earlier, so that everyone can, get to their best health. By actively participating in the community, this is why it's important for us to take this community-based approach. I believe that we can contribute to improving health outcomes for everyone.
Yeah, thank you for that. I really appreciate that explanation. And I think one of the things I heard you say is the idea of how important access is for folks, and that's how we can start to address some of those barriers, or we need to address the barriers in order to increase the access. It reminds me of what Jasmine was saying, is what she's seeing in her role. And then the barriers in general, it sounds like you were saying a lot of those are systemic, things that are structural that we need to work through, and go into something that Lucia mentioned, like the interpretation services, right? Do we have structures in place to allow people to get the best care possible and lead their husbands' lives? So really appreciate that. Anything that anyone else wants to add to what you just heard that Dr. Edwards shared? If not, we can transition over. Okay, good. That means you just said it all right, and there's an amen from everybody. Okay, good. So I'll pass it over to our next panelist here, last but definitely not least. So Casey McGrath has worked in healthcare and insurance fields for over 20 years. And so she's a member of, and also is a member of the steering committee of the Indigenous Health Coalition through Common Ground Health Initiative, and a committed advocate for health equity among the Haudenosaunee Confederacy and the Alliance of Six Sovereign Nations. So we appreciate having you here. We're also aware that in general, the Indigenous Health Coalition is a newly formed group. And so congratulations on that. I know we'll make a lot of great impacts on the work that folks are looking to do. And so could you share with us who are the members of the coalition? And from there, what are some of the goals that the coalition is looking to achieve, or barriers we're looking to address?
Thank you so much for having me. Yes, we are a very newly formed organization. Thank you very much to Wade. We are comprised solely of individuals who identify as Indigenous, and we have representation. I personally work for Excellus. I've been in health insurance and healthcare for 20 years, but we have representation across the board. We have doctors, we have professionals, we have students, we have a very diverse group. And I had to smile when Lucia was talking about the diversity within the Latinx community, because it's very similar in the Indigenous community. So we have representation from, I believe, most of the Six Nations in the Iroquois Confederacy, the Haudenosaunee, as well as some who identify in tribes that are outside of that confederacy. Right now, we are still focusing on our charter. We've only had 2 meetings so far, and the first meeting was very inspirational. We discussed what we really wanted to focus on and how to help. And I love the focus of driving data, right? We don't have any clear data on Indigenous health disparities. So it's really hard to identify where we need support. And in our tribal communities, we know things like diabetes, things like high blood pressure, that those are all representative of struggles that we have due to the healthcare disparities. However, there's no data to back that up. So I think that that's what I'm most excited about within our work, is identifying that data and really getting a firm grasp on the true disparities.
Yeah, thank you so much for sharing that. And the data is important. I really think as far as health equity, that's one of the central lanes of being able to address, because you can't fix what you don't know. And so we're thankful that you and the coalition are focused on that. And Wade, I think you came off mute. Did you want to add anything to that?
Yeah, I would, and I would just want to affirm this incredible point that Casey is making, that in the absence of systems delivering data, our response as community is not to be satisfied with the lack of data, but to really understand the power of community to generate, to document, collect, and disseminate data. And one of the things that our Indigenous brothers and sisters have done beautifully was they conducted a listening tour. And they just went and captured the wisdom they know exists in the community. And with our support, really turned that real qualitative data into actionable information. And I think the democratization of data, the fact that we have information that is of value, is a real powerful organizing point for communities to do that which is necessary to effectuate transformation, and that is lead the way with facts.
Yeah, thank you for that. Definitely agree. You know, the saying what matters is measured, right? And so it's like it should matter, so we got to measure it. So thank you so much for stating that. I did have one follow-up question, and in case you feel free to say, I can take that and get back to you. But one of the things that shocked me individually a couple months ago is I was looking at the percentage of individuals who are non-elderly and don't have insurance, right? And the number one group for folks who identify as Native or Indigenous, which really like that blew my mind in that way. And you mentioned that you worked in insurance. I figured I might ask, could that potentially be one of the goals with the coalition? Is something that might be on your mind, or how could we go about addressing that?
I would love that. I feel like that data is conflated simply because a lot of our tribal communities rely heavily on Indian health services, and the clinics within our tribal communities. My concern about that is that those are often understaffed and or staffed with medical professionals who are fresh out of college and may not have the experience for the healthcare access that we need. But yeah, I think that that's a terrific point. I think I do feel strongly that's why, though, is that there's other resources that they're utilizing that may not be the best, and ensuring our tribal communities would be very, very helpful.
Got it. Thank you so much for taking that off the cuff question. Answered it great. Appreciate
I
it.
got you, Herb. No problem.
Yes. Okay. So I got the note that we can take a little bit more time than we had allotted. So we're gonna go ahead and do that then. So we're gonna go through just a couple more questions for folks. I think this has been very insightful for me personally, and definitely probably for our audience, right? So just to go back to Jasmine, if we can. So um, there's been a conversation or multiple conversations about a BIPOC-led birthing center. Is that something that can put us on a pathway to wellness? Thinking about what you just mentioned earlier when it goes to representation being important, and how could such a center positively impact maternal health outcomes? All right, Jasmine might have to take a call. You know, babies don't stop. So we'll go ahead. We'll circle right back to Jasmine and come back if she needs to. So Wade, can I shift to you? And then we'll circle back to Jasmine. Okay,
Sure.
great. Perfect. Appreciate it. So going back to you as the CEO of our resident health data organization. So you mentioned how important data is. So what were your major takeaways from the pandemic, right? Knowing how that disproportionately affected many Black and Brown folks, to be honest, right? And how we can use that learning to put us on a path towards improved community wellness.
Let me just start by saying before takeaway, what did we bring to it? And I don't think it was just common ground. I think it was a lot of folk who are on this call. What we brought to the pandemic response was the understanding of how Dr. Fauci was right when he said in April of 2020, that the pandemic didn't bring or do anything new, but rather what it did was shone a light on long-standing inequities and the incredible price that we pay for having allowed those inequities to persist. And I think the community coming into a community pandemic response with that attitude really empowered us. And folks may not remember it because we were living it, but we absolutely moved from the literal top-down approach being driven by Governor Cuomo at the time and the presidents at the time, because it straddled two administrations, to really get to a grassroots up and out approach. And we move from having big mass vaccination clinics to having ones in the neighborhood designed and tailored for the folk who live there, by the folk who live there, in partnership with the folk who live there. So I think that the major bringing into the pandemic was the incredible power of community. And I think that what we understand is trust is the coin of the realm. And as Dr. Nichols and Dr. Joy told them, relationships matter. And I am truly committed, because I said we were not going to leave out of the pandemic and then try and rebuild the old normal. There ain't no going back to the old normal. There needs to be a new normal, where we look at the resources for health and wellness and we make sure that they are matched intelligently with the needs of our neighbors in this community, and a focus on prevention and an understanding of the importance of public health. I am committed to making sure that as we continue to pursue health transformation, we hold on to it was the power of us that made sure that babies got fed lunch when schools got closed. It was the power of us that made sure that transportation was provided to church communities to make sure that folks got vaccinated. If we can do those things in the middle of an emergency, we should be able to say those are the things we do because they're the expressions of community, because they are the expressions of love.
Yeah, thank you so much. So I really appreciate those words. And I think what I took away from that is going into the pandemic and coming out, what you're taking away is the things that have been going on for so long can't happen anymore. And we need to be accountable to that. And if we are going to address that, it's tapping into our own communities who really stepped up in order to address the needs that were there. So I really appreciate that word. Okay, so
And if I can just affirm the power of having community-based organizations, the insurers, and the hospitals on this panel reflecting the true diversity of our community, that's going to be our strength as we march towards our future.
Yeah, thank you for that. And thinking about the community and representation of folks who look like us, Lucia, can I shift to you really quick for our next question? Talk about the class or the culturally and linguistically appropriate services standards. And one of the things that they actually highlight as important is the recruiting, promoting, and supporting a workforce that is responsive to the needs and reflective of the needs of the community. And so when we think about just, especially here in upstate New York, in this region in particular, the growing refugee or migrant populations, how do we start to remove those barriers to address some of the things that we're seeing in our healthcare and really other systems?
Yeah, so I want to highlight the recent report published by the Latino Health Coalition under Common Ground Health, which is unheard. There's a lot of great information in that report, and to no surprise, we know that as of 2020, there are over 90,000 Latinos living in the 9-county region, right? So that's a big deal. We are growing, and our needs continue to grow. Those who know me in this region know that I am a community health worker, and I always talk about community health workers because I think that in this profession, we don't get enough recognition for lived experience and those grassroots individuals that are so important, like Wade mentioned, those grassroots, what got us through the COVID-19, I think, is that we had great relationships in the community, and we were able to utilize those individuals that have those great relationships with community. But we have, a strong need for community mobilization. when it comes to workforce development in human services and in medical services, and including the peers and the community health workers or promotores de salud, which are primarily the same thing as community health workers, except with a focus in Spanish, so providing services in Spanish 100%. Their lived experience is crucial. So that way we can build and enhance the workforce, but at the same time, by doing this, we're providing linguistically and culturally appropriate services, right? So we have seen the growth and the mobilization of the CHW profession more within the past 3 years, right? Like during COVID, there was a high utilization, but we still lack support when it comes to respecting the profession, their lived experience, and sustainability and responsible funding to support these programs, because that's the key for CBOs struggling to hold these programs together for the outreach efforts or for prevention efforts and things like that. We can create wellness programs that are in our case, 100% in Spanish. We can hire individuals who are primarily Spanish speaking, right? Because that's the objective, and offer those services. We also, I remember when I worked for one of the healthcare systems here, and I hired a community health worker who primarily spoke Nepali. And this individual had tried to apply several times. I took a chance, even though her English wasn't, fluent, because we had a high population that we needed to serve. And, it was interesting because she ended up doing work outside of my program because others identified this person as someone who had the skill set and also could meet the linguistic and cultural needs that we were having in the emergency department, right? But if I didn't kind of like say, hey, let's give it a shot, because we have certain systems that are looking for very specific, either credentials, accreditations, or some sort of certification, it makes it difficult for us to integrate those two. So we still have some more work to do when it comes to that, but I think that could help in supporting some of this, some of this vision that we have of integration of community-based organizations and also the healthcare system.
And thank you so much for that. That was actually going to be my follow-up question when you answered that, because you mentioned how important a lived experience can be in the work that we're looking to have folks do. And that example with the person you took a chance on who made an impact, not just in the work that you had in mind that they would do, but also in emergency services is great. How lived experience can actually translate to having a real impact in different spaces. So thank you so much for sharing that. Okay, so just a couple more questions and then we'll look to close out here. So Jasmine, if it's okay, I'm gonna circle back to you with this quick last question about the BIPOC-led birthing center, because there have been some conversations about that being a potential. And so my question is that could that be, thinking about our theme for today, right? Getting beyond trauma into journeying into wellness, right? Can that be something that puts us on a pathway to wellness? And how could a center like that have a positive impact on maternal health outcomes?
Yes, so Black-led facilities definitely has an impact on our community as far as that. I'm going to go back to that community-based approach. The community-based approach, it puts more knowledge and more access in our communities by providers and access to partners and providers who look like the people who they will be serving, which is very important. As far as impact goes, we have a better impact on our people naturally. It's the connection that we have naturally. And we naturally have a trust. I know for me, as when I was a community health worker, one thing that people that I served directly, they were comfortable and they had trust as soon as I came in the door because I looked like them and I connected with them on a different level. So there was, I was the middle person in their care. So where they didn't trust their provider, I was able to come into the home and I automatically provided them a level of comfortability where I could talk to them about their care and help them get back into care. And when they kind of fell off the wagon, say, hey, you know, you have to follow up on these kinds of things, right? Whether that was during pregnancy or when infants were born, hey, take that baby back to the doctor. That baby needs a healthcare plan. That baby needs to be seen on a regular basis. You know, checking up to make sure that they're up to date with their immunizations. They didn't want to have those conversations with the providers because they didn't feel seen or heard. So I was there to advocate with them and help support them so they can advocate for themselves, teach them how to advocate for themselves. So when you have a Black wellness center, those things, we don't have to fight some of those things. They can walk in the doors and actually have a level of comfort, and they know a level of support and understanding of who they are and where they come from as soon as they walk in the door. So having that model, that community-based model, it will help break barriers. It will help the infant mortality rate, adult mortality rate definitely go down because you will have people with more access to better care. They feel more comfortable talking to providers about what's going on. They feel comfortable following up instead of waiting to the last minute and overusing emergency centers, right? Going when they absolutely have to, instead of having that continual flow of care. So yeah, Black centers, I'm on for it. Healthy Baby Network, we're doing the work, and we're excited. We're excited to provide that to our community. We know how much it's needed. Just working with our clients alone, I could speak a little bit to the doula program. We've seen cesarean rates go down, but we've also seen breastfeeding rates go up with our people. We have a 94% breastfeeding rate. That's a dramatic, increase. It's a positive increase. It's impactful. Breastfed babies, they're less likely to be sick, you know. So it's a positive for our community. It starts our babies off with a better health palette, right? So there it is. The impact is right there. It's also when we go in and we help moms breastfeed. We're very hands-on. Those other children in the household or those other family members, they're seeing what's going on. They're being introduced to something positive for our community that's definitely passes down great health.
Anyway, thank you so much for sharing that. And I just want to take a second to pause and say like how important it is to even be having conversations about a BIPOC-led birthing center, right? Like those conversations that we see, some of the data, right? Like Black and brown folks are 20% less likely to be prescribed pain medication for the exact same concern as their white counterparts. A lot of that's like not being listened to. So we can navigate through that and say, I have somebody here who will probably listen to me, right? Because they understand what I'm navigating will be great. So we are excited that that's even a part of the conversation. And the data that you just shared that you're seeing now is great. So thank you so much for sharing that. So we got our last two questions and then we'll close out here. So Casey, I want to go to you first and then Dr. Edwards, I'm going to close out with you. So just last question, thinking about the steering committee and the health coalition. Could you share with us from your lived experience, what you've seen, what you know, what are some of the methods that Indigenous folks kind of navigate trauma and develop pathways to wellness? And then what are some ways that the greater population can assist in helping to facilitate healthier Indigenous communities?
Yes, definitely. So historically, our communities have not navigated trauma very well. We've ended up with substance abuse issues, poor eating habits, and those are all things that we're trying to overcome now and focusing on mental health. Many of our tribal communities take individual steps towards that, and it's really dependent, going back to the diversity in our communities, it's dependent on each tribe themselves. So some of our more traditional tribes don't have the same funds that our less traditional tribes have due to casinos or what have you, what other streams of revenue. But the focus is still there. We're trying to go back to our more traditional mindset. Focusing on the 7 generations theory. So living your life to set the world up for the future 7 generations, thinking 7 generations ahead and living with a good mind. And those are all concepts that were prominent prior to residential schools and prior to the intended genocide of our people that we're getting back to. But that's still a struggle. So you'll see our less traditional tribes that do have casino gambling revenue, they have substance abuse clinics, they have mental health clinics set up to help navigate that generational trauma, whereas our more traditional tribes still rely on Indian Health Services and the clinics that we mentioned earlier that there's disparities there too, right? So even within our own community, there's healthcare disparities. As far as what the broader community can do to support us, I would say this question actually tripped me up a little bit, Herb. I was thinking about it for a while, but I would say an increased cultural competency would be the first thing that I would like to see from non-Indigenous folks. And that is, I've seen it. So my lived experience, my brother went into kidney failure at the age of 25 due to high blood pressure, which is something that Black and brown people suffer from at higher rates than their white counterparts. But 25, that was scary for me. We were at a local hospital, so I'm in the Buffalo region, and we were at Mercy Hospital, and there was a nurse there, and he was just amazing. He actually discussed why Black and brown people were more susceptible to high blood pressure. And he allowed me, because my mother's passed away, so I am the matriarch of my family, and we do follow a matriarchal society. So he respected that, and he allowed me to answer questions on my brother's behalf, even though that's not really traditional in Western medicine. It was very refreshing to have that support for our traditional values and to understand that that is okay, that it's going to have better impact if we're honored, if the terminology utilized is not offensive. So please don't say you're going to have a powwow when you're really having a meeting. That's not, representation matters, and that's not the representation that we want, in my opinion. You may get something completely different from another Indigenous person, but that's something that's important to me.
Yeah, well, thank you so much. I know you said that that question was hard, but you answered that really well. And I think that first part, as far as what can or how are folks navigating trauma, he said right now, like many of us are working on that, right? Still trying to figure out how to navigate that and navigate that well, especially based on some of the painful history of dispossession and so many other things. So thank you for sharing that. And then the wider community, it kind of like boils down to this thing we like to say here of doing with and not for, or with and not to. So how can we have folks be participants in their healthcare, right? And not just objects. So I really appreciate that. And actually being informed by the folks who know best, which are the people who are showing up to our healthcare facilities. So I really appreciate you showing up.
Thank you so much.
Yeah, no problem. So I'm going to go here to Dr. Edwards. I'll come to you, and then we'll close out with some closing comments from the group, and then we'll wrap up there. So Dr. Edwards, first, we appreciate that Excelis is an empowerment sponsor of the conference, which is great to help be able to put this on and have such an amazing session for folks to learn and engage with information. Going back to what we talked about a little bit earlier, like the importance of a thriving community. So from your perspective, what does community wellness look like for Excelis? And what are you and your colleagues currently working on to help us get there?
Yeah. So thank you, Herb. I think the professor in me is forcing me to start with a definition of community wellness. So I'm gonna please indulge myself here. So according to the National Wellness Institute, community wellness is defined as an active process through which people become aware of and make choices toward a successful existence, Community wellness requires action to unlock the full potential of the individual and the community at large. I started with this definition because it's important to then align with the mission of Excelis and what we're doing here. And at Excelis, we want everyone. It's our mission, it's our commitment to achieve their best health. And in that mission, we say everyone, and that's a loaded word because we are not all, we have to meet each person where they are, right? Health equity is about removing those barriers and getting everyone to their best health. One of the ways that we're choosing to do this is to really engage our members, having them participate fully in getting to this, this goal, right? So late last year, we asked our members to share with us information about themselves so that we can better understand their unique needs. So we began to ask them questions around their language preferences, and Lucia, you spoke about this. We asked them to share their gender identity, their race, their ethnicity, etc. And their answers are going to help us understand if there are any gaps in their healthcare and what we can do to provide or address those gaps or those needs. So you may be wondering, what are some examples of potential gaps that we're anticipating seeing? And we talked about this, Lucia talked about this at length. So for instance, if English was not someone's first language, they may be more comfortable with a provider who speaks their own language, right? Or be able to have translation services to help support their understanding of what their provider is telling them, right? So if we have that data, if we have that information, we can then tailor the services needed for that particular person. Another example I wanted to share is, we know that certain racial and ethnic groups, we see some certain disease states being so prevalent in certain racial groups, such as diabetes, cardiovascular diseases, hypertension, etc. So it's important for us to understand what our members look like so we can, my light went out. There's somebody in here. My apologies about that. But we need to know this information so that we can provide specific clinical programs, right, to address the unique needs of, folks in particular populations. So that's one thing. That's one way we try to engage our members. The other way I spoke about a little bit before is through a community-based approach, through our grants and awards. So we have a Health Equity Innovation Award that we have awards, multiple, and we also have our member and community health improvement grants, our MACI grants. You may hear us refer to it as MACI. Some examples of some of those grants, I'll just give one for the interest of time. For example, the Monroe County Family Coalition, we funded the mental health education program. They give one-on-one consultation with social workers, financial literacy programs. They refer individuals to crisis support resources in collaboration with 211. I have other examples, but I won't get into those, but you get the idea. It's really engaging the community. We talked a lot today about the importance, and I think Wade had mentioned this, the importance of us keeping engagement with our community-based organizations that we continue to want to strengthen. And making a change takes time. I want us to be mindful of that. We are trying to break a system that has been in existence for many, many years. So we have to be kind to ourselves and understand that it will take time. But if we continue to work together, And I'm committed to working together with all of the stakeholders to make this happen, and keep these programs going. We can see sustainable impacts well into the future. So again, happy to be here, happy to be committed to the work, and thank you for allowing me to talk today.
Yeah, thank you. Well, thank you for being here to speak. We appreciate all the great things that you had to say, and I really appreciate that the idea of community wellness being for everyone, but it doesn't mean that we take a colorblind approach, right? And try to see how do we engage people on an individual community level basis, which is great. And I really appreciate the commitment to collecting better demographic data so we can identify the gaps there, which is good. I actually got one of the postcards from Accelerate.
Yes,
Hey,
thank
let's
you.
look at the demographic data, what you're doing. No, which was good. So I think that's really that's really good. It reminds us of we did a similar thing here, but we asked because we care, which is how we try to get information from folks to help better serve people. So thank you, and thank you so much for the work that you all are doing. So I do want to close out here with some closing comments for folks. What are some things that people can take away, or if you had to leave something for people to take with them, what would it be? And so I don't want to call on anybody like class. Does anybody want to raise their hand and kind of start us off with some closing comments?
I'll start. I'll just like to leave with our Healthy Baby Network slogan over here. Every mother, every father, every parent, every baby. I said that wrong, but you get the point of it. It's just the family structure. Going back to community, we focus on mom, we focus on baby, we have to focus on father as well, so we can have that family structure and heal our families, and that helps heal our communities and brings it back together. So I just wanted to leave with that.
Thank you so much, Jasmine. See you.
Yep. So I think that as we are healing from what we just went through with COVID, we have a real opportunity to focus on those issues that just basically messed us up, right? During that time, we saw our communities really suffering, and now we have an opportunity to try to catch up. But if we don't move forward, then we're going to be back here after another, because that's just how the world works. We don't know what's coming next. At some point we're all saying, Jumanji, what's next, right? Because there's just one thing after the next. And at what level are we at now? But we have a real opportunity. And I have faith, just by listening to what everyone's saying here in this panel, that we are going to move forward. But we really need to be very disciplined to make sure that we don't lose track of what we need to do. Because if we don't, then we'll be back at the same place, and we don't have time to lose. So I wish you all well, and great to spend some time with you all.
Thank you, Lucy. I guess I can jump in if that's okay, Herb.
Yeah.
So to that point, Lucia, I quickly pulled up a quote that I like to share, and I'd like to share with this group. It says, vision without action is merely a dream. Action without vision just passes the time. Vision with action can change the world, right? So I think with all of us here, we're working to change the world. And I think we need to have a vision. Everyone has a vision. We want to make sure that it's the same vision. The way we look at it is making sure that we are identifying and addressing health disparities, social determinants of health. And most importantly, and oftentimes this is not talked about a lot, is addressing the systemic barriers that are in place in our healthcare system. We need to address those, eliminate those in order for us to make the change that is necessary for everyone to have a fair and their best health. So I'm sure that the way we get there is with all of the stakeholders on this call, people who are listening, coming together, tapping into our community-based approach that we talked about today, to be able to get to that, to get to our vision. So again, I'm happy to be here and see a lot of people here who are engaged and doing the work.
Thank you, Dr. Edwards.
Herb,
Wait.
I'll jump in and I will say and I consider myself to be well acquainted with grief and having to have spent a lot of my adulthood healing from trauma and from loss. Though you all who know me know I've been very upfront. The major price paid personally by this pandemic was I've been separated from you all. And I got a lot of hugs, still I got to catch up on. And I would say as we prepare for this weekend and a day on, not a day off, I just remind us in the theme of this conversation, Dr. King shared with us life's most persistent and urgent question. What are you doing for others? We will reach community wellness and we will remove inequity when our purpose is larger than ourselves and focused on each other. Thank you, Herb, for the opportunity.
Well, thank you for sharing. And Casey, I want to go to you to close us out with any final remarks.
Sounds good. I want to thank you for allowing me to be a participant on this. It's been a wonderful experience. I think if anything, COVID has shown that our BIPOC communities are strong and resilient. On this pathway to wellness, we are our strongest advocates, and I think community is huge. So this has been amazing. Thank you.
Thank you. And thank you so much for sharing, Casey. And before I pass it back to Brother Underwood, I just would also kind of close up here and say, thank you all for having me to be able to moderate and facilitate. Folks who work with me here know, giving me a microphone, you never know what's going to happen. So I appreciate the trust in that. And I do want to just maybe summarize some of the things that I heard as we were closing out. So I heard relationship, which ties really well what we heard first from Dr. Nichols and Dr. Georgia Grew, family-centric, listening and being together, which I almost can summarize as community, right? How we lean into our community. And then at the end, I really want to lean into what Dr. Edwards said about how do we take our community, how to take a vision for our community and put that into action so that way we can get beyond trauma into wellness. So I appreciate you all sharing those final thoughts. And I think this is really impactful for the audience. And I know it's impactful for me. And I plan to take some of this back to our team here so we can implement some of those things that we've learned. So thank you all again. Appreciate you having me. And Brother Underwood, I'll pass it back to you.
And thank you. And don't go anywhere, panel. I just want to on screen, hopefully somebody take a picture of this panel, please. What an outstanding group of people. And Wade, I think it's an unusual spot for me because I'm the elder here. So I want to just big up all of the young people and the person whose first number is going to change sometime this year. But Herb, excellent facilitating, and I learned so much. And particularly, what I love about this panel is when we look at representation, and one of the things we've heard is representation matters. So Casey, lifting up the voice of our Indigenous brothers and sisters, we don't do that enough, and we wanted to be really deliberate as ABC in doing that. To hear from my longtime friend Lucia about that diversity inside of the Latinx voice is really important, and she's been a trooper for language access and all that it takes to get us to that equitable place. Jasmine Sawabona, I see you. I just know that it took a whole lot of courage and grit for you to be here in this moment. I'll leave it at that, but just say thank you. And Dr. Edwards, we gonna be besties. You just don't even know it yet, but we gonna be real tight. I'll follow up. There's a couple things that you mentioned I want you to forward me, because when we summarize this entire conference, there's some key takeaways from each of you that we want to make sure that we capture.